Yeah, the reason that we're here today is to announce two exciting developments at University of Kentucky and the College of Health Sciences. The first is a $4.2 million grant that we've recently received from the Department of Defense to continue the work that we've done for the last 15 years in preventing unintentional injuries to our Special Forces operators. And this particular grant will be working with our Marine Raiders. The second reason is that we're also announcing the establishment of the Sports Science Research Institute, a commitment that the University of Kentucky UK Healthcare has made to bring a scientific component to the area of sports medicine and sports science. We began studying sports-related injuries about 25 years ago and identifying the risk factors that contribute to high incidence of injuries in athletes. We were approached in early 2000 by the Department of Defense, who were observing very similar injury patterns in their elite special forces operators, and asked if the models that we had created in the sports medicine environment could easily be applied to the special forces environment, which it could. The injury patterns that were being observed across all the armed forces, and particularly in the special operations community, were called the unintentional injury and a hidden epidemic within the United States Armed Forces. And those consisted of musculoskeletal injuries that were being sustained during training and mission simulation. And these were the same type of injuries that we'd been studying in the sports environment, injuries that were occurring during high-velocity tactical activities, and activities that were associated with landing and jumping and cutting and climbing. So our research model enables us to identify what those injuries are, identify where the deficiencies are in these elite warriors, and then provide them with very specific interventions, training programs to mitigate the risk of these injuries. And fortunately, the early work that we did here in the state of Kentucky at Fort Campbell resulted in significant reduction of approximately 15% of all of these unintentional musculoskeletal injuries. SSRI is the UK Sports Science Research Institute that's going to give us the capacity to study the musculoskeletal injuries that we have been discussing this morning, but also give us the ability to expand the research. So the SSRI is going to provide us with a wonderful state-of-the-art contemporary research facility that really will enhance quality of life and performance of the recreational athlete to the elite collegiate and professional athlete. There's a significant commitment now for UK Healthcare to expand the research capabilities of the enterprise, and especially as it relates to musculoskeletal health. And the SSRI is an important contribution to the portfolio of UK Healthcare, and why UK Healthcare has made such a commitment to this research enterprise. And we have a significant partner in UK Healthcare that is enabling this to become a reality at the University of Kentucky.